everyone, I'm Rosie from Voluntary Services, and today I'm just going to be doing a video on the correct PPE requirements for when you visit patients on a ward. Volunteers are expected and required to follow the correct PPE requirements when visiting patients on a ward. This is for both safeguarding and infection control purposes to protect yourselves, patients and staff. The first requirements that volunteers need to follow is the correct dress code. Volunteers must wear a t-shirt identifying them as a volunteer. This new requirement is so staff and patients can easily identify volunteers on the wards. They must also wear their trust ID badge visibly at all times. You may be challenged by staff when entering wards if you don't know who you are. Please explain who you are, why you are there and which patient you've come to visit. You also need to make sure that you are bare below the elbows and wear appropriate footwear and trousers. With regards to PPE, the requirements is that volunteers appropriately follow infection control procedures and change PPE between patients. Volunteers are only permitted to go into wards with green COVID status. No volunteers will attend wards where there is an amber or a red COVID warning. If you feel unwell or have any COVID symptoms, it is important that you stay home and get a PCR test. You must remain at home until you are feeling better, and if you have COVID, your period of isolation has finished. Volunteers must wash and sanitise their hands frequently. They must also wear a hospital-issued facial covering. The correct sequence to wash your hands and wear a correct face covering will now be shown. So firstly, you would wash your hands before touching the mask. You would then pick the mask up and inspect the mask for holes or tears. Find the top side where the stiff metal edge is and place that on your nose. Make sure you pinch so you have a close fit to your nose, and ensure that the blue side is facing the outwards. You cover your nose, mouth and chin and ensure that there are no gaps in the mask. It is not appropriate to pull your mask down over your nose, as this defeats the purpose of wearing one. We also ensure that we're not hanging it off by the ear, as again this would defeat the purpose of wearing a mask. When you remove a mask, remove it from behind your ears and dispose of immediately. You would then thoroughly wash your hands to make sure that no germs are transferred from the patient or the ward to yourself. Other types of PPE, such as gloves and aprons, are not required when visiting patients on wards. These types of PPE are to protect staff from fluids when providing clinical care for patients. Volunteers don't provide clinical care for patients, and therefore those types of PPE are not necessary. In the additional video on our YouTube channel, you will see the correct procedure for washing your hands. Thank you very much for watching this video. See you all soon.